Hello everyone, I'm Jordan, and today we're delving into a crucial topic, methadone and its role in treating opioid addiction. We'll explore what methadone is and how it works in the body and its effectiveness. We're also going to distinguish methadone from other substances used to treat opioid addiction. Additionally, we'll touch on some success stories of individuals who've used methadone to overcome their addiction, and furthermore, we'll dive into why opioid addictions are particularly challenging to overcome compared to other substances. And lastly, we'll be examining how methadone supports individuals in achieving sobriety. First off, what exactly is methadone? Methadone is a synthetic opioid medication that has been used for decades in the treatment of opioid addiction. According to American Addiction Centers, methadone is a long-acting opioid agonist used to manage pain and more commonly to treat opioid use disorders, also known as OUDs. It's regularly employed in medical detox to manage opioid withdrawal and as a maintenance treatment for OUDs. Methadone works by binding to the same receptors in the brain that opioids like heroin and prescription painkillers target. However, methadone acts more slowly and for a longer duration, which helps to prevent withdrawal symptoms and craving without causing the intense euphoria associated with other opioids. This prolonged action makes an effective medication for managing opioid dependence. Next, it's important to discuss how methadone differs from other substances used to treat opioid addiction. Unlike medications such as buprenorphine and naltrexone, which have a ceiling effect or block opioid receptors, methadone is a full opioid agonist. This means it fully activates opioid receptors in the brain, providing relief from withdrawal symptoms and reducing cravings without causing the same level of euphoria as other opioids. Methadone's full agonist properties make it a valuable option for individuals with severe opioid dependence who may not respond as well to partial agonists or antagonists. Now, why are opioid addictions so challenging to overcome compared to other substances? This question leads us to delve into the complex nature of opioid addiction and the hurdles individuals face on their path to recovery. Firstly, opioids have a profound impact on the brain's reward system, hijacking its natural processes. When opioids are consumed, they flood the brain with dopamine, a neurotransmitter associated with pleasure and reward. This flood of dopamine creates an intense feeling of euphoria, reinforcing the desire to seek out and use opioids again. Over time, the brain becomes accustomed to the presence of opioids and may even reduce its production of dopamine in response to natural rewards, leading to a diminished ability to experience pleasure from everyday activities. When taking a look at the National Institute of Drug Abuse Association, when someone tries to stop using drugs, the strong associations between drugs and related cues and new or ongoing experiences of stress may lead them to experience cravings and use the drugs again. Returning to use after stopping, also known as relapse, is not uncommon for opioid addicts. Secondly, opioid withdrawal symptoms can be excruciatingly uncomfortable, both physically and psychologically. These symptoms, which can include nausea, vomiting, muscle aches, anxiety, and insomnia, can be so severe that individuals may feel compelled to continue using opioids to avoid them. The fear of experiencing withdrawal symptoms often acts as a barrier to seeking help and entering treatment. Moreover, opioid addiction is often intertwined with complex psychosocial factors such as trauma, stress, and mental health disorders. Many individuals struggling with opioid addiction face underlying issues that contribute to their substance use, such as past trauma, chronic pain, or untreated mental health conditions. Addressing these underlying factors is essential for sustained recovery, but can pose significant challenges without appropriate support and resources. Finally, let's explore how methadone supports individuals in achieving sobriety. Methadone not only helps to alleviate withdrawal symptoms and cravings, but also provides stability and structure to those in recovery. According to SHM publications, in one study, more than 40% of individuals who use drugs reported unprescribed substance use during hospitalization. Opioid agonists like methadone treat opioid withdrawals and may decrease in-hospital substance use while improving trust. By reducing the intense urge to seek out opioids, methadone allows individuals to focus on rebuilding their lives, participating in counseling and therapy, and addressing the underlying issues contributing to their addiction. Methadone treatment is often combined with comprehensive support services, including medical care, counseling, and peer support to provide a holistic approach to recovery. To round off, methadone plays a vital role in the treatment of opioid addiction by providing relief from withdrawal symptoms, reducing cravings, and supporting individuals on their journey to sobriety. However, it's essential to recognize that methadone treatment is just one part of a comprehensive approach to addiction recovery, which may include counseling, therapy, and support from loved ones. If you know someone who is struggling with opioid addiction, don't hesitate to reach out for help.
My name is Abby, and the first thing I'm going to be going over is how much opioid treatment costs. In our healthcare system, the cost of methadone treatment in a certified opioid treatment program would typically run about $6,552. The treatment for buprenorphine is a little less than $5,980 per year. However, opioid use disorders and overdoses cost the United States a significant amount of money. It was estimated in 2013 the United States spent $78 billion on disorders and overdoses. Of this amount, only $2.8 billion was for treatment. That is only 3.6% of the total cost. So it's certainly a worthwhile endeavor from an economic standpoint to treat addiction. There are many misconceptions about treatment, and resistance in using methadone and buprenorphine for treatment is sometimes based on these misconceptions that medications will produce euphoria in people who are not dependent on opioids. Although this is possible, these medications affect people who have developed a high tolerance to opioids differently. These medications do not cause a patient to become high. Instead, it just minimizes the withdrawal symptoms and the cravings for opioids. This will allow the patient to participate in other forms of treatment and eventually will help them become free of their substance abuse disorder over time. One of the reasons people continue to take opioids is to avoid the negative withdrawal symptoms. These include anxiety, jitters, nausea, and sweating. Medications in the early stages of withdrawal will help alleviate these symptoms. People are more likely to stay on a treatment plan if the withdrawal symptoms are less severe. Other countries in Europe have much lower rates of opioid overdose. Now let's go over how they achieve this. The opioid death rate in Switzerland is 1/20th of the rate in the United States. Switzerland has become a model for highly effective evidence-based policy. Switzerland's approach to addiction is very different from the United States. In Switzerland, addicts are given instant access to a week's worth of medication. There is no requirement for counseling, drug testing, or a punishment if they relapse and use illicit substances. These methods are what European experts say is the key to their success. Other European countries like Germany, Australia, France, the UK, and the Netherlands legally allow addicts access to methadone more easily than in the US. Swiss lawmakers took an age-old debate, drug policy based on treatment or drug policy based on law enforcement, and chose a multi-pronged plan that placed a heavy emphasis on treatment and harm reduction. In particular, easy access to clinics that offered addiction medications like methadone and buprenorphine. Now, the next question is if the U.S.'s attitude is shifting with these other countries for using methadone and other medications as treatment. With increasing overdose deaths in the U.S., American doctors and lawmakers are starting to advocate for liberalizing access to methadone. They believe it is the best tool to address this crisis. Addicts who take it are 59% less likely to die of opioid overdose. On Capitol Hill, a coalition of Democratic and Republican lawmakers have introduced legislation that would allow trained addiction doctors to prescribe methadone and pharmacies to dispense it. The director of the National Institute on Drug Abuse announced for the first time in 2022 that she believes physicians should be able to prescribe methadone directly to patients and believes that if the U.S. is allowed universal access to methadone and buprenorphine, opioid deaths would fall by 50%, if not more. Opioid use disorder is also very prominent in the criminal justice system. So about half of federal and state prisoners are considered to have opioid use disorder, and rarely is medication used to treat opioid disorder while people are incarcerated. Sadly, opioid use often resumes after release. Overdoses are more common when a person relapses due to loss of tolerance. For inmates, the risk of death within 2 weeks of release is more than 12 times that of the other individuals. Treating inmates while they are incarcerated can largely change their outcome, and inmates who engage in methadone treatment and counseling in prison are more likely to enter community-based treatment centers after their release. They were also less likely to test positive for illicit opioids at 1 month following their release.
My name is Kessa, and I will be discussing potential questions that clients may have for this prescription. To be a client for opioid agonist therapy is just a fancy way of saying they're taking methadone or buprenorphine as treatment for addiction. Some clients may have questions like, are there any side effects to taking opioid agonist therapy? There are only about a handful of people who experience side effects of this therapy, and when they do, it's pretty early in the treatment and when they're on a higher dose. Side effects tend to be stronger when using methadone rather than buprenorphine. These side effects can include constipation, excessive sweating, dry mouth, changes in sex drive, drowsiness, and weight gain. Another question could be, are there any safety risks to taking this therapy? Thorough research has been done regarding both of these drugs, so many people take this therapy for years without any ill effects. However, they are still very powerful drugs and can be dangerous for those who are not prescribed. Children are particularly at risk, so it's best to keep your treatment in a safe of some sort because even a small dose can be fatal for a child. All opioid drugs have a risk of overdose. Methadone is riskier than buprenorphine. The risk of overdose is higher when a client starts their treatment. Mixing opioid drugs can also increases the risk of overdose. Zubsolv is a combination of both naloxone and buprenorphine to treat opioid use disorder. Zubsolv is similar to Suboxone, which is also a combination of naloxone and buprenorphine. Zubsolv, like Suboxone, is taken in a pill form placed under the tongue and allowed to dissolve. Another medication more recently associated with treatment for OUD is Probufine. This controlled narcotic is an implant device that utilizes buprenorphine to help with opioid dependence. 4 small rods are surgically inserted into the arm for the patient. Following insertion, Probufine then works to consistently deliver buprenorphine to the patient in regular doses. While this is a relatively new way to administer buprenorphine, more research into this effectiveness as an MAT is needed. Lofexidine is a recently approved drug used for opioid withdrawal treatment. Used previously for the treatment of high blood pressure and anxiety, this drug has been shown to reduce withdrawal symptoms, but not to the degree that methadone does. However, it's important to note that early studies also show that the withdrawal period was shorter than with methadone. Naloxone is a medicine that rapidly reverses an opioid overdose. This means that it attaches to opioid receptors and reverses the blocks and effects of other opioids. Naloxone can quickly restore normal breathing to a person if their breathing has slowed or stopped because of an opioid overdose. But naloxone has no effect on someone who does not have opioids in their system, and it is not a treatment for opioid use disorder. It is recommended that clients talk to their doctor before using buprenorphine together with methadone. Combining these medications may reduce the pain-killing effect of methadone and or increase the risk of a relatively rare but potentially life-threatening irregular heart rhythm. You may be more susceptible if you have a heart condition called congenital long QT syndrome. Other cardiac diseases, conduction abnormalities, and electrolyte disturbances. For example, magnesium or potassium loss due to severe prolonged diarrhea or vomiting. The primary objective of treatment centers is to provide comprehensive care and to support individuals seeking to overcome addiction. Treatment centers aim to help patients achieve and maintain long-term recovery by offering a range of services including detoxification, counseling, therapy, education, and aftercare support. Their goal is to address the physical, psychological, and social aspects of addiction to promote healing and a successful return to a fulfilling life from substance abuse. It is widely known that rehabilitation facilities are there to help people to overcome addictions. While many try to do this on their own, it can be incredibly difficult without the support of professionals backing you up. Whatever addiction or challenge you may be facing, it is always best to get a team of people behind you to help you through the process. Rehabilitation centers have trained therapists and medical staff that are well-versed in helping people to overcome addictions, making this the number one main goal that these facilities are trying to achieve. The next goal is to help those who have entered the rehabilitation program to return to normal life. Whether you are coming for an extended period of time or if you're making time during your week to come for classes and therapy, there is a path that you enter that can help you back to life after addiction or before addiction. While it may be something that you are always experiencing, spending some time in a rehabilitation center can get you back on track to life before an intimidating consuming addiction. The third goal is to help those who participate in the recovery programs to obtain the proper mental tools to experience continued recovery. Overcoming addiction is absolutely possible, but you are likely to encounter triggers and temptations along the way. Ensuring that you're equipped with the right mental tools to overcome these triggers will take you far in your continued addiction recovery.
We would also like to go over the effects of these options for pregnant women and what the safest options are and the outcomes for the fetus. A study published in 2017 showed that buprenorphine had a lower risk of neonatal abstinence syndrome compared to methadone. Buprenorphine has a ceiling effect on respiratory depression, making it potentially safer in overdose situations. It's a partial opioid agonist, which can lead to severe neonatal withdrawal symptoms compared to full agonists like methadone. A study published in 2015 found that infants born to mothers receiving buprenorphine had shorter hospital stays compared with those born to mothers receiving methadone. Another study in the Journal of Addiction Medicine concluded that buprenorphine-exposed infants had shorter hospital stays and shorter treatment duration for NAS compared with methadone-exposed infants. Methadone has been used for opioid dependence in pregnancy for several decades and has a well-documented safety profile. Methadone can be associated with a higher risk of neonatal abstinence syndrome compared to buprenorphine. Unlike buprenorphine, methadone is a full opioid agonist. While methadone has a higher risk of NAS, it is a more established option, and neonatal care for NAS is well documented. Methadone-exposed infants may require longer hospital stays and treatment durations compared with buprenorphine-exposed infants. Research published in the Journal of American Medical Association in 2017 found no association between buprenorphine use during pregnancy and an increased risk of major congenital malformations. A study in 2018 found no significant increase in the risk of major congenital malformations associated with methadone use during pregnancy. Based on this available research, both buprenorphine and methadone can be used to manage opioid dependence during pregnancy, but buprenorphine may be associated with a lower risk of neonatal abstinence syndrome and potentially shorter hospital stays and treatment durations. However, the choice between the two should be made in consultation with a healthcare provider based on the specific circumstances and needs of the pregnant woman. These medications have both been demonstrated to be superior in aiding withdrawal treatment compared to others. Buprenorphine and methadone have demonstrated superior efficiency over other drugs in treating opioid withdrawal, attributed to their pharmacological properties, safety profile, and established effectiveness. Each medication offers unique advantages in various contexts, and the decision should be made in consultation with a healthcare provider, considering the specific circumstances and needs of the patient. Methadone maintenance treatment can keep the people who are dependent on opioids in treatment programs and reduce their use of opioids. It's most widely used in replacement for medically supported maintenance or detoxification programs and can make a big difference for the needs of the patient.
To conclude, methadone stands as a cornerstone in the treatment of opioid dependency, particularly during pregnancy. Its well-documented safety profile and efficacy in reducing overdose risk made it a vital tool in harm reduction efforts. Moreover, methadone's role in aiding addicts' recovery journeys cannot be overstated. By stabilizing individuals, it allows them to engage in comprehensive treatment programs, addressing not only their physical dependence, but also the underlying psychological, and social factors driving their addiction. While acknowledging its association with a higher risk of neonatal abstinence syndrome, methadone remains a valuable option, offering structured support and a pathway to recovery for both the mother and the fetus. The decision to utilize methadone should be guided by comprehensive medical assessment and tailored to the individual's needs, ensuring the best chance for successful treatment outcomes and long-term recovery.